Hello, everybody. I'm Leslie Horton with Yavapai County Community Health Services. I'm the director here. And Stephen Everett is joining me. He's the Yavapai County epidemiologist. And we're here to give some information about COVID-19 as it stands now. $50 cases of COVID-19 since we started testing back in March of 2020. Currently, we're averaging about 53 cases a day, which has been about the same average for nearly, I would say, about 2 weeks now. We've seen a slower increase in overall cases since last year, around the same time, but we also saw the outbreak start last summer a little bit sooner than we saw this year. So our outbreak this year started right around 4th of July weekend, and it is continuing to build. However, it seems to have leveled off, at least for the last couple weeks. Yet we are in substantially high transmission in Yavapai County. And so it's important that we take this virus seriously, as we are also seeing a steep increase in hospitalizations, which is probably our biggest concern at this point, and that YRMC currently has 38 hospitalizations, VVMC has 3, and the VA has 2. And so many people, when they get COVID-19, especially if they're young and healthy, may not have severe symptoms. However, we are seeing people that are younger with the new variants of COVID that are getting sicker quicker and more severely. So the hospital reported to me last week that they're seeing the ages of hospitalizations skewed younger this time, whereas before, in previous increases in COVID and increased hospitalizations, we were seeing more of the hospitalizations over the age of 60. Now, many of our hospitalizations are skewed younger, around the ages of 40 to 60. And so we are seeing, on average, many of the people that are getting severely ill in Phoenix and around the state are averaging about age 35, which is different from previous strains of COVID. We are seeing quite a bit of the Delta variant crop up in Yavapai County as well as across the state. However, the only labs testing for it are the state lab and TGen North, who does testing in the Verde Valley and for Verde Valley Medical Center. So we do have some information as it regarding how many people are getting the Delta variant, but if someone gets tested at this point in time, they often don't get those results given to them. So that is one thing to keep in mind, that if you have symptoms, you can't generally go and ask for that result to be delivered to you, whether it's a variant or not. You'll just hear if you have COVID-19 or not. And that being said, we do recommend that if you have symptoms of COVID-19, you need to get tested. It is important at this point in time because a lot of people are having symptoms of what seems like a light head cold and not getting tested. However, they're interacting like normal, going to work, going to school, and it is spreading COVID-19 pretty rapidly across our state and in Yavapai County. So right now, we are seeing people testing positive primarily in the unvaccinated populations, but we are also seeing breakthrough cases of people that are vaccinated. Anywhere between 10 and 20% of our cases at this point in time are folks that are vaccinated. However, people that have been vaccinated or have had COVID in the past tend to see far lesser severity in their symptoms. And so sometimes it lasts a shorter duration, or it's not as severe as they might have if they hadn't had COVID-19 before. But we do ask that people still get tested so that they cannot, or they will not spread the virus to others and can isolate properly if they have those symptoms. I'm going to let Stephen cover a lot of the information on current, pardon me? Sure. Let me go ahead and finish up though here, and before we pass it on, we're actually going to be joined by Chairman Brown of our board Board of Supervisors, and he's going to give a little bit of information. But I just wanted to say also that since schools are starting, many of them starting today, some started already, and I know Prescott Unified and other school districts are starting within this week, that we do highly recommend masking in the schools, even though many of the schools cannot mandate it based on some of the governor's rules. It is a recommendation from the health department that if people are sending their kids to school, that they consider having those kids wear a mask. We do want to slow down this spread of COVID-19 and make sure that people can send their kids to school, whereas we are seeing some of the schools that have opened so far without masking, they are having a high rate of infection among students. And then we have to also follow those quarantine protocols as we did last year. So we'll be working with the schools this year, making sure that we can help them to slow down the spread of COVID-19. But we do know that it's rapidly spreading in our communities, and it will at times enter the schools. And so as much as you can help us, try to encourage masking among the students, and also encourage the students to wash their hands often, to physically distance as they can, but most importantly, for everyone in our community, please stay home if you're sick. That is the one thing, if I can drive one point home today, is to, if you have any sort of symptoms whatsoever of a head cold or things that you think might be COVID-19, please stay home, get tested, and find out what you have so that we can stop the spread locally in our communities. So thank you very much. I'm going to pass this over to Chairman Brown. And David, if you can help me with that, thank you.
Good morning, Leslie, and everyone that's on this transmission, I guess you could call. Anyway, I just wanted to say to everybody, we have been watching these numbers as we have for the last year and a half very closely and see what is going on within the community. And I thank Stephen and everybody in health services for all their diligent work on keeping track of these numbers, and especially from the hospitals and our other partners that are out there. And we just want to let you know that in advance of the way the numbers are currently moving, we've had a number of discussions and meetings in regards to what we may do into the future, and have decided as of this coming Thursday, August 5th, the counties will go back into a situation where our buildings will be closed to the public in general. However, if you call or make an appointment or come to our doors and call the numbers that'll be listed on the outside, then our employees will come out and meet with you and or bring you into our facilities, but generally they will be closed. And everybody will be wearing a mask at their when they're away from their workstations, and all of our employees will be asked to get vaccinated, and we have arranged for other clinics to be available for vaccination additionally. So we're hoping more people will get vaccinated, then we don't have to do this type of lockdown, if you will. We want to make sure that our services are still available to the public, but we can't take any more risk with the amount of employees that we see coming down with COVID-19, which has gone up dramatically over the last 3 weeks. And to quote one of the employees who didn't get vaccinated, he is very sorry he didn't, and he says he wished he had, because he said, quote, "Nobody wants this, believe me," unquote. So moving forward, we ask the people in the public, get vaccinated. There's plenty of opportunities. It's free. The government's paying for it. Go to your pharmacy, your doctor, the hospitals, and the other locations offered by our community health folks. And we'd like to get as many more vaccinated as possible. And it's the best way to prevent from getting very sick and possibly being hospitalized or even dying. You have to remember, the worst statistic we've come out of this is those that were not vaccinated represent 99% of the deaths. So please think about it. Thank you.
All right, thank you very much, Chairman Brown. And we do have some changes on the horizon which do follow the most recent CDC guidance. And so I realized that most people were excited when masking kind of went away for a short while. But right now, with the temperature of COVID and as it's spreading so rapidly, it is important that people consider masking in indoor spaces, whether they're vaccinated or not. We do need to slow down the spread and do our best to keep this community healthy and resilient. COVID is not gone yet. One of the things that I do recommend is if you have not been vaccinated, please get vaccinated. Chairman Brown just mentioned this, and I want to reinforce that. There's lots of opportunities around the community. If you're 12 or older, find out how you can get vaccinated. If you only got one shot the first time around and need to get that second shot, please make sure that you consider doing so. And so on our website, we have lots of information, not only the guidance that we're going to share today, but the locations where you can get vaccinated, as well as some of the school guidance that is current and up to date as it stands now from the CDC. So I'm going to go ahead and pass this over to Stephen. He's going to cover some of the information on the numbers, go into more detail, as well as some of the current guidance from the CDC. So thank you, Stephen.
Okay, thank you. Our numbers are definitely going up. Going from 19,000 to 20,000, it took us about 2 months to reach that amount. And in the past 2 weeks, we went from 20,000 to 21,000. So we're definitely seeing increases. Fortunately, so far, our deaths are staying down. It usually takes about 2 weeks to see the difference of the deaths going up, but we haven't seen that yet as we have in previous spikes. So hopefully that trend will continue. Our senior population is doing really well in getting vaccinated, and we hope that trend continues because that is where we saw most of the deaths. With this particular, with the Delta variant, we are seeing more 40 to 60-year-olds getting sick versus the 60 and older people. So you want to be aware of that. If you have any symptoms whatsoever that are related to COVID, fever, cold-like symptoms, loss of taste and smell, you definitely want to you want to be tested. With regards to vaccination, there has been some questions regarding, is it better to have natural immunity or immunity through vaccination? The CDC has been saying that both groups have roughly the same amount of antibodies. So you will be just as protected with a natural immunity as you would with vaccination, though I do recommend vaccination because the effects of actually being sick with COVID are a lot more miserable than just having a sore arm. So definitely go get vaccinated. If you have any symptoms, get tested. If you are vaccinated and you have symptoms, get tested. Your symptoms are going to be a lot milder. And so you'll have very more cold-like symptoms than the more severe symptoms you would see if you were unvaccinated.
All right, and the newest guidance.
The
if
newest
you don't mind
CDC
covering
guidance.
that for us.
They are recommending masks. CDC is recommending masks. If you are vaccinated and you have symptoms, wear a mask, isolate yourself. If you've been exposed to a person, but you are vaccinated, if you've been exposed to a person who has COVID, wear a mask, but you do not need to isolate. You could be contagious, but it's highly unlikely that your viral load tends to be a lot lower than if you were showing symptoms. So you would be much less contagious than you would if you were actually sick. If you're unvaccinated, that has not changed. If you have been exposed to someone who is suspected or confirmed COVID, you want to quarantine yourself for 14 days. There are some exceptions to that. If you go 10 days and you have no symptoms, you only have to quarantine for 10 days. Or if you get tested on the 5th to 7th day, after 7 days without symptoms, you can go back to work, but you must be tested first.
And I think so. For one of the questions that I've had a lot of people asking to just this morning even is if they've been vaccinated and they come down with symptoms, what is the isolation guidance? And actually, if someone's been vaccinated even though their symptoms might be far less than someone who is unvaccinated, they still have to follow the same isolation guidance.
Yes.
So that would be 10 days from the onset of symptoms and 24 hours symptom free. So it's not either or, but it is 10 days from the onset of those symptoms, even if they're feeling better after day 2. But they also need to help us to stop the spread and make sure that they have been symptom free for 24 hours.
Well, 24 hours without fever.
Without fever.
If you have other symptoms, but they are resolving, you can return. So if you have a cough, but it is getting better, you can return. You don't have to wait till the cough has totally subsided. But fever is really the main key. As long as you have fever, the fever is resolved for 24 hours, then you can return to work.
All right. Thank you for that.
You're welcome.
We've got a question.
And I think we have some questions in the chat, so I'd like to be able to have enough time to answer those questions. And we also have Sally Slater on the line. She is our immunization nurse coordinator who has been helping to get vaccinations out county-wide for the last several months. And so she's here to also pipe in and answer questions as they come in as they relate to vaccinations. So thanks, Sally, for joining us. All right. Do we have a way of reading the questions to us?
Well, and we can put some up on the screen, but the first one was, where's the best place to get tested?
There's lots of opportunities to get tested. And so, you know, on our website at yavapai.us/CHS, we have all of those testing locations mentioned, but there's testing throughout the community at many local providers. All the urgent cares offer it. If someone is admitted into the hospital, they get tested. And many of our Community Health Center of Yavapai locations are doing testing, as well as Spectrum Healthcare and many, many other providers around town. So please, if you need to seek out testing, go to our website and you'll be directed at a convenient location. Also, the Walgreens and CVS are still offering testing at their locations as well.
So we've got one that says, I'm deeply concerned about our children. It's on the screen. And the ones who are not old enough to get vaccinated. Mayo Clinic and masks make a difference, but everyone has to wear one for it to protect them. Let's talk about children.
Absolutely. And what we do know of masking an individual child, if the whole school is not masking, is that it can help reduce their possibility of getting COVID. So we do know that masks work best if they're on the person that is sick. However, they do reduce the risk of those wearing them no matter what. Another thing, like I mentioned earlier, is to recommend washing their hands often. If they notice that someone is visibly sick, to stay away from those, as well as make sure that they also, let's say, stay home if they get sick. But masking does help. And I know our schools are going to work to create physical distancing as they can. Many of the schools are working with our team to make sure that there's protocols in place that work. Even if mandating masks is not the case in your school, you can still highly recommend that your student wear a mask to cut down their risk.
The next question is about that. When are schools going to be informing us about changes that are being made?
Schools will inform you as they make those changes. And so most of our schools do have an advisory council at this point in time for COVID-19, or are in close consult with Stephen, our epidemiology team, as well as Carol Lewis, our assistant director, and our team is out there helping our schools to make decisions based on the current climate of COVID in that community. And so we keep stats on each community and which age groups are affected. And each time the school has a case, they'll be consulting us. If they need to make changes, they can do so based on recommendations from the health department. As there's outbreaks, we'll be informing folks, as well as, hopefully the schools will be informing parents in a timely manner. Stephen, do you have anything to add to?
Yeah, with children, we see a lot of people saying, we don't really have to protect children because they tend to have mild or no symptoms. That is true, but that does not mean that they're not contagious. So even though your child may not be showing any symptoms and is positive, he or she can still give COVID-19 to someone else. So that is why it's important to mask them whenever you can do it, and keep them protected and prevent them from getting COVID until we have a vaccine available for them.
Yeah. Another recommendation too is if there are more vulnerable folks in the household, to make sure that those people are vaccinated. Kids may see some exposure throughout the school year this year. We can't avoid that completely. So making sure that those more vulnerable folks that are eligible for vaccination get vaccinated will help us to cut down their risk of severe illness or hospitalization in the home.
We're getting questions about, is there a specific test for the variant with rapid pickup?
No, there isn't. Well, there's no rapid test for it. You're not going to find out whether you have the Delta variant if you get tested at a regular lab. What occurs is that a certain segment of positive tests get later sent to a diagnostic lab, which tests for the COVID variant, but individual patients will not be informed of that. It's mainly for data collection, and it really doesn't affect your care. And usually you won't find out whether you had Delta variant or not until well after you're over the disease.
That's a Sally question.
Yes.
Is there something specific you wanted Sally to address?
Is there questions that would be more relatable to Sally's expertise?
Well, this one says, when will children younger than 12 be able to be vaccinated to achieve herd immunity?
That'd be a good question for Sally.
So for the children younger than 12, Pfizer has applied to the FDA to be able to vaccinate children as young as 2 years old. That has not gone up for approval yet. They're hoping next month. So we should see more information coming out on that next month down to the 2 years old for the Pfizer vaccine. At this time, J&J and Moderna are not going for that.
And then also this one, can I get a second series of shots?
Not at this time. There is no recommendation by the CDC that we need to do boosters or repeat any series of vaccines, and we will not be offering that until further guidance comes out suggesting that we should do that.
Right, back to and then, do we know yet how far transmission can spread outdoors through the aerosolized particles and how long they can remain in the air?
Stephen, I think that one's for
I just
you.
wanted to see if Sally was going to answer that. Sorry about that. Outside is generally much more effective at preventing spread because of sunlight. Sunlight, as the old adage goes, is the best disinfectant. And with wind currents, it's always hard to measure exactly how far it'll spread or how effective it'll spread. Indoors, it's a lot easier. It's a lot better controlled environment, so the air tends to be a little more stagnant. So when you cough, sneeze, it'll go generally straight in front of you. It usually goes about 6 feet. They're transported via droplets, so they'll go out and they'll fall to the ground. Some can go greater than 6 feet, but generally speaking, we would say 6 feet. Most of it will go out and you're more protected farther from 6 feet you are. But outside, especially out in the sun, if it's a fairly breezy day, it's safe.
Yeah, and I heard a recent study that said only about 10% of the overall cases that we've seen of COVID-19 across the nation have been in outdoor spread or as a result of outdoor spread. And so I think it's very important to be careful if you're crammed in with a lot of people in very close proximity, that you take precautions and you can mask up. But otherwise, outdoor recreational activities are pretty low risk when it comes to, especially if you can keep physically distanced, as Stephen mentioned, as with weather conditions and other conditions outdoors, the chance of spread is far less than in indoor spaces.
This one says, I'm not vaccinated, had a head cold, stayed quarantined, and did at-home COVID test, which turned out negative. Should I get antibody tests to see if I had COVID?
You can. That's strictly optional. We don't recommend one way or the other, mainly just for your own curiosity's sake.
You want to talk about school? Will we have any drive-up vaccination events? Not at schools, but just drive-up vaccination events.
So some of the schools are asking us to set up vaccination events at the schools. We're also having communities that are asking us to do pop-up events for anyone who is eligible for vaccines, depending on which vaccine we're using. The Pfizer is still the only one for 12 and over. And so we do have providers in the community that are providing that vaccination. So as there is a demand for vaccination, we will definitely be popping up vaccine opportunities anywhere that we can. The schools are a good location, as parents have to come pick up their students and are in and out of the school campus on a regular basis. But there's also opportunities through many of our local pharmacies, through all of those locations I mentioned earlier. And if you're looking to get vaccinated, please look at our website and find out where the upcoming opportunities are for those vaccines. The schools, though, will probably keep their parents informed and the communities informed as they schedule those locations, and we are encouraging them to do so.
Someone says, so are you saying that touching surfaces is less likely to spread a virus? Am I safe from all of this self-checkouts as long as I'm wearing a mask?
Stephen, do you want to answer that?
It's the masks really are to protect others. So you want to be in self-checkout lines where a lot of people are wearing masks. So not just yourself. It's good to wear a mask. Hopefully more people will wear masks outside. It'll give you some protection, but you're more protected when other people are wearing masks as well.
And I think the other part of that question was, are surfaces safe now? And more studies are showing that less COVID spread is happening from touching surfaces. And so it still is, of course, important to wash your hands, be careful and cognizant of how much you're touching your face. If you've been touching a lot of surfaces, as there can be active viruses on surfaces. But COVID-19 tends to spread more in air particles. And so that's where the masking does help more significantly than the sanitizing of surfaces, although we still recommend it for many reasons, including the flu, which spread cuts down readily with sanitization as well as masks.
Where can we find school information?
We have that posted to our website, the yavapai.us/CHS. Has great information on school guidance, as well as resources that they can use for education and posting in hallways or in nurses' offices or in classrooms. And they can always call our offices as well. So give us a call. We can give guidance and support to any school-based questions, or especially directly to those schools that are looking for guidance.
Someone asked, should vaccinated friends start wearing masks again when socializing in small indoor settings?
It definitely can't hurt. If everyone's vaccinated, you generally are protected. You have a little more leeway, but again, if you wear a mask, it's an added layer of protection.
And someone is just saying, can we please provide vaccines drive-up for children and adults? Outdoors.
There are going to be opportunities throughout the communities, and we can probably offer some of those outdoors. The vaccine handling for this vaccine is very fragile, and so in Arizona, in the heat, sometimes that's not conducive to the proper handling protocols, but we will try to do more outside in convenient locations where anyone and everyone can access those opportunities that is eligible.
Someone's asking, how many vaccinated breakthrough cases are there in our area? Percentage. Also, are those that are currently hospitalized and vaccinated more older ones?
I can answer the hospital question, but if you want to talk about breakthrough.
Oh, breakthrough is very low. We were seeing about 85% vaccinated, 15%, 85% unvaccinated, 15% vaccinated in the hospitals. That may have changed recently. It's been a while since I had the opportunity to look at those numbers, but we're definitely seeing more unvaccinated people having the symptoms than unvaccinated.
All right.
Unvaccinated people having more symptoms than vaccinated. I'm constantly going to get that mixed up.
That's okay. And, from a report that I received from the YRMC hospitals, Dignity Health on Thursday of last week, they mentioned that over 90% of their COVID-19 positive admissions have been unvaccinated. That number has varied over time. Sometimes it's as much as 15% and sometimes far less. And so we are seeing that as about an average of hospitalizations due to vaccinated folks being around 10%. And we do know that with the vaccines, there was an efficacy rating of each, and we've been giving all 3 types of vaccines. So there's going to be a range there of efficacy of the vaccine, being its ability to stop severe symptoms or spread of COVID-19. And so therefore, 90% currently is about the average. And in terms of the demographics of their admittance for COVID-19, in prior outbreaks of COVID-19 and during the last spike over the last holiday season, their spike was heavily skewed in the 60 plus category. And now what we're seeing is that we do have a higher rate of people in the 60 plus category that are vaccinated. Sometimes 70 to 80% of those older age groups are vaccinated. And with the new variants, we are seeing people that are younger getting sicker quicker, as well as more severely. And so right now at YRMC, their demographics for COVID-19 admits are skewed more heavily towards the 40 to 60 year age group, is what they reported to me. They have also seen young adults and children admitted for COVID-19 care.
How do we learn where, when the pop-ups will be offered, especially drive-through outdoor ones?
We will post those to our website at yavapai.us/CHS. As locations are offered, we will make sure that those are posted to the website.
Do we have any data on those who have been reinfected after their 2 shots? If so, what are their symptoms and severity?
We have data. I don't have their symptoms available. I'm still writing the analysis program to that. And we're also a little behind on our data entry just because of the number of cases we have. But hopefully we'll have that information within the next few weeks and for the general public.
Is it true that vaccinated people cannot donate plasma to COVID patients anymore?
I've never heard that one. It should not have any effect. It's not a live virus, so it shouldn't affect blood donation at all, as I'm aware.
What about large group gatherings? Should they be avoided?
Yes, I generally try to avoid larger group gatherings, especially if it's a group where people are close together. If it's something like, say, the movie theaters where they have, they're spreading people out, so there's a little more social distancing between individuals, that'll be a lot safer. But the more closely you're packed, the more at risk you are.
This is for Sally. What is one vaccine more effective than the other?
Pfizer and Moderna vaccines are both right up around 95% effective. And then the J&J is a little bit less effective, but that's just the 1-dose series.
This is for anybody, I guess. What is YRMC capacity at this time? Is there any current strain on local services similar to last winter?
I would say that that's primarily for them to report if they're changing their services. Now, I do know that in conversations last week, they were at full capacity. And so they're not at the extent where they were last year around the holidays when they had to cut back completely on electives and other non-essential services, but they are probably going to have to make adjustments in the services offered if they continue to see this increase in COVID-19, because they do obviously have to direct care to those folks with COVID. And therefore, the more we can reduce the chance of hospitalization through vaccination or masking when indoors, physically distancing and doing things to protect ourselves, the better off our hospitals will be and the more chances they'll have to proceed with electives. As we do know from the last outbreaks, things that are elective now may become more emergent later, and we don't want to put those surgeries off. And so the more you can help us to reduce hospitalizations in general by acting accordingly with the current guidance, we'd appreciate that, because I know the hospitals are concerned at this point.
After traveling, how long should I wait to get a 30-minute COVID test before returning home to high-risk family?
The CDC, for international travel, the CDC is recommending 3 to 5 days of quarantine before getting tested. The test is most accurate after 5 to 7 days. That'll give enough time for the virus to develop in your system if you actually are sick but are asymptomatic, for the test to pick up as a positive result. Under 5 to 7 days, the virus might not have enough of a presence in your nasal passages to elicit a positive effect.
What is the overall survival rate of unvaccinated?
Overall survival rate is about 2.5%.
No, survival rate would be
Oh, I'm sorry,
97.
mortality rate.
97.5.
So 97.5 survivability. I'm getting everything backwards today. I
That's all
apologize.
the questions we have so far. Yeah, that's all the questions we have right now.
All right.
Okay.
Sounds like we've answered most of the questions that have come in. I do appreciate those of you that tuned in for your time and your attention to this important matter. I know a lot of people have decided that COVID-19 should be a thing of the past, or that it's not as severe as once thought. But what we're seeing based on our hospitalizations is that we are still seeing this spread rapidly. We're still seeing that people are being hospitalized, especially those unvaccinated. So the more you can do to help us, the better our community will be, the less restriction that will have to be employed over time. And we do hope to see an overall reduction in number of cases. We don't want to see what's happening in Florida and other states where it's very severe to happen here. And so the more you can help us, the better. We appreciate all that you're doing every day to try to slow the spread of COVID here. We realize some of this is out of our hands, as this is a new virus still. And as it mutates and we see these variants, there's new things that we're learning all the time, and try to relay that information to you so that you can make the best choices based on your risk, your overall health, and the resources that are available to you. And so, Stephen, do you have anything you'd like to add?
Mainly get vaccinated, cover your cough, wear a mask, social distancing, and use basic hygiene.
Oh, I want to thank our interpreter for following along with us. I realize it's a lot to keep up with, and we want to make sure that there's resources there for anyone who is tuning in to be able to hear what we have to say, or at least see what we have to say. And I also want to thank the chairman of the Board of Supervisors for being online and helping to kind of provide some insight into what the county is doing in regards to COVID-19 and some of the changes we're seeing. We hope to see, any of these mitigation measures can change at any time. And we do hope that eventually we'll see the spread slow down so that we can take some of these measures back away. But for this point in time, I feel like he's made some good decisions based on protecting the employees of the county, as well as slowing down spread in the community. And then I want to thank Sally Slater for being involved and answering some of these questions. She has done so much work, as have our team at Yavapai County Community Health Services. Our epidemiologists have worked tirelessly now for a year and a half in trying to keep up with COVID-19. Sally coordinated vaccines across the county and was pretty much the point person, and still is, for COVID-19 vaccination, and trying to make sure as many people have convenient opportunities to get vaccinated as possible. So thank you, Stephen, for joining in. And if there's no more questions, David? All right, well, thank you both. David and Terry have been here to help me, and they are our public information officers at the county, and make sure that you stay informed. As we know information, we try to share that, and we'll have more opportunities to share information like this. And thank you, everybody, for tuning in. We appreciate your involvement and your help in slowing down the spread of COVID-19. Thank you.